Thank you, Professor Gupta ji. So very interesting because since morning I'm witnessing the patient voices, the other people. It's very interesting to note about that. And the asymmetry information is one of the key things which is coming up. It's the asymmetry of information between the providers as well as the patients. Patients are at the receiving end. Even the providers also, they do have the asymmetry of information. I will just cite my example. When I was medical student, I started putting on weight. So I got my admission in 84 and I was exposed to Bhopal MIC, and in 86, 87 I started putting on weight. The professor HOD, he put me on Lasix and pot cloth thinking that is an effort. So I have consulted 4 or 5 physicians, renowned physicians in Bhopal, but of no respite. At that time the endocrines and other things were not investigated. You see that the information, because in books, the Hutchison manual, we say that a higher degree of suspicion should be there so that a diagnosis is not missed out. The same with the case of the person who was in the morning, the TB person was there, and somebody at the end, they have asked him to go for a. So it was, Dr. Reddy would be appreciating that. So what has happened, I developed pericardial effusion also at that time because of mixed edema. It has progressed to that extent. There was one cardiologist, he just asked one question. I'm just saying that information asymmetry, how it works. He just asked me one question during the month of July, how you are feeling. It was a sultry weather, I told that it's okay. He just touched my hand and told that skin kitna rough hai aapka. Immediately he could make a clinical diagnosis of this. And that kind of clinical diagnosis is now missing. He could make a clinical diagnosis of hypothyroidism, and then the investigation of other things started. That I will start from there. But most of the healthcare in the country is provider-centric. We're very sorry to say that we have been focusing too much emphasis on providers. And providers usually see that the convenience, whether it is comfortable to them or not, you take the labor rooms also, you see that it's all provider-centric, not patient-centric. The labor rooms, labor tables and other things is all provider-centric. That means I should be comfortable, my convenience has been taken care for that. That's one thing. And apart from that, the values and the preferences of patients usually takes the back seat. Some of the preferences usually have been catered because they want a good clean room, that's the 5-star hotel or 5-star hospitality. That kind of things have come up. In the rural areas also, you will find good private institutions with having lot of facilities which as per the preference of the patient. When we were doing that, when we were focusing on quality, then this kind of things also came up. Besides that, if you look at the way this healthcare for the patient, whether it is affordable or accessible, there are many things, many indicators which tell that it is going towards the providers, not to the patients. If you talk about the accessibility and affordability, though a lot of efforts have been made to improve the accessibility, making things affordable, but if you look at the high out-of-pocket expenses, then you will realize that where we stand and what efforts which we are making. The information asymmetry, Srinath ji has already mentioned about that, I won't be dwelling much, but you look at the information asymmetry. Even among the providers, information asymmetry is there. And not to talk about the patients. Patients, they require to be informed. And it is related with the patient education. I have not gone to after getting it, I am not getting any opinion from endocrinology because I have to manage myself, because I am aware, I have got all the information, I am managing myself. I am not visiting neither the top endocrinologist, whatever say, I don't listen to the word, because I know how to manage myself. And I am able to guide people also, so that's the way things are happening. That's another thing. But information asymmetry is one of the very stark reality which one need to address for patient. Then beside that, patient engagement, though in NHM programs, when the communitization of the health happened, in that we have tried to involve the community in the decision-making process. But lot is to be done, because if you go to the Latin American countries or other countries where the patients are involved in the decision-making of the treatment plan. So till the time they come into our system and contribute to the decision decision making of a treatment plan, that means a lot of work needs to be done in that direction. Right now they are into the decision time, but you look at the way people are interested in helping the health fraternity and the healthcare providers. Look at, if they think that there's a crowd is a problem, they will come and help you out with the crowd management. If they find that the water is a problem, they will try to help up in coming up with water plants and other things. If you say that the cooling is a problem, they will see that the cooling and other things has been taken care. That means these are small things. But if it is done in a very organized way, you can always see that how together people can at least make a change. Because a lot of changes has happened at the community health centers and the other places where the community and the people, they are involved in the decision making. Other thing is we are using, there are many efforts which have been made. One is we are gradually shifting at seeing that how the patients is used. The digital mechanisms are there, digital health records have been made, then telemedicines are being taken care. And besides that, we are trying to see that how we can enhance the involvement of the patients in our day-to-day other things. This is work in progress. I think now awareness is coming that patients need to be a part of the decision-making process, apart from decision-making process in the running of the institution as well as the treatment plan of the patient. So these are the two things I think a lot of work could be required. And thank you very much.